According to the National Institute of Health, anxiety disorders are the most common mental illness in the U.S., affecting 40 million adults in the United States age 18 and older. How many of you have ever had a panic attack? I don't mean the mini heart attack you have when you can't find your phone. I mean when you can't breathe, you're all sweaty, you can't stop shaking, and chances are you've thrown up at least once. You can feel your heart pounding in your chest and you feel incredibly dizzy. That's what it's like to have an anxiety attack, more commonly known as a panic attack. To demonstrate what it feels like to have a panic attack, I'm going to show this video.
A panic attack goes from 0 to 100 in an instant. It's halfway between feeling like you're faint and feeling like you'll die. If you miss a step on the stairs and your stomach lurches, it feels like that, but lasts much, much longer.
Fighting for breath, feeling like the floor's unstable.
Trapped in your own head while floating somewhere outside, looking back at yourself, wondering what you're doing.
A huge fist grabs hold of my insides. My heart goes into overdrive and I go through the motions in autopilot.
Like when you're in a dream and you're screaming but you can't make any noise.
Your entire body is feeling everything and nothing all at once.
And you just want to jump out of your skin, get away from this feeling.
But I just keep thinking, this will pass. This will pass.
And it usually does.
Anxiety disorders cause severe health problems such as increased risk for heart attacks, depression, even thoughts of suicide. Understanding the symptoms of anxiety disorders and helping those people get proper medication or even therapy would solve this nationwide problem. More people should understand what it means to have an anxiety disorder because it's a serious mental illness and the people that have it deserve help. According to the Anxiety and Depression Association of America, anxiety disorders are the most common of all psychiatric illnesses affecting children and adults. Every anxiety disorder is highly treatable, yet only 1/3 of those suffering from an anxiety disorder receive treatment. According to the University of Rochester, on a brief overview of anxiety disorders are categorized as the following. Generalized anxiety disorder, or GAD, which is characterized by excessive and unrealistic worry that lasts more than 6 months. Symptoms include trembling, muscle aches, insomnia, abdominal upsets, dizziness, and irritability. Here's an audio clip describing general anxiety disorder.
So, here's my friend. He worries about things. Of course, everybody worries. It's natural. But this guy has got generalized anxiety disorder, GAD, and he pretty much worries all the time. You see, people with GAD have trouble turning their worrying and anxiety off. There's a sense of impending doom that terrible things will happen, even when there is little evidence that anything will actually turn out bad. This constant and uncontrollable worry gets in the way of having a more normal day-to-day life, and many experience physical symptoms like fatigue, muscle tension, insomnia, and mental tensions like concentration loss, nervousness, stress, and all of this can contribute to an inability to go places or experience and enjoy things, and to simply be happy. And this in turn will stop. There is help out there. There are methods to approaching and gaining control over your negative thoughts. You can look into support groups, cognitive behavioral therapy, and possibly even medication. Talk to your health professional for more information.
There's also OCD, or obsessive compulsive disorder, which is characterized by persistent and repetitive thoughts, which are commonly known as obsessions, that reflect exaggerated anxiety of fears. Those obsessions may lead to an individual performing a ritual or routine known as compulsions to relieve the anxiety caused by the obsession. There's also panic disorder. People with this suffer severe panic attacks, which make them feel like they're having a heart attack or they're going crazy for no reason. Symptoms include heart palpitations, chest pain, sweating, trembling, feeling of choking, fearing of dying, and feelings of unreality. Another one is PTSD, or post-traumatic stress disorder. PTSD can follow an exposure to a traumatic event. Often soldiers have this when they come back home because of witnessing so many deaths. and it can also be a result from a sexual or physical assault or a natural disaster. Symptoms include flashbacks of the traumatic event, detachment from others, difficulty sleeping, irritability, and poor concentration. Another one is social anxiety disorder, which is extreme anxiety about being judged by others or behaving in a certain way that might cause embarrassment. This may lead to behavior of avoiding people and social interactions. Symptoms include heart palpitations, faintness, flushing, and profuse sweating. The last type of disorder is specific phobias. People with this suffer from an intense fear reaction to a specific object, recognized as irrational, and can lead to the avoidance of common everyday situations. Every disorder creates obstacles in that person's everyday life, and it can be very challenging. Anxiety is defined as a feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome. Someone that has an anxiety disorder constantly has to deal with this feeling nearly every day due to seemingly normal things. It interferes with someone leading a normal life, and according to WebMD, anxiety disorder is just like every other mental illness, is caused by changes in the brain that regulate fear and other emotions like stress. And studies have shown that severe or long-lasting stress can change the way that nerve cells within these circuits transmit information from one region of the brain to another. Anxiety can have many long-term and short-term effects on people. Those effects can harm both the body and the mind. According to the University of Maryland Medical Center on-site guides, nearly 18% of people with any type of anxiety disorder attempt suicide, and about 40% of people with anxiety disorders think about suicide frequently. A short-term effect of anxiety is not being able to complete everyday tasks, increased breathing rate and heart rate, possible nausea, and more blood to your brain. The effects of anxiety are because of your body going into what is called fight or flight during times of stress. Adrenaline gets released and your immune system gets a boost, and your breathing rate increases so more oxygen gets to your brain. But if you frequently feel stress and get this fight or flight type of feeling, then your body would never return to normal functioning. According to Harvard Medical School, people who suffer from anxiety quite often have a weakened immune system, problems with their digestive system, and more risk for heart disease. Anxiety is a serious mental illness, but luckily there is a solution. The people that have any type of anxiety disorder deserve help, and to help them, everyone should recognize the symptoms of the anxiety disorders and help them get the medication or therapy that they need. A common problem with helping people with an anxiety disorder is that some people may refuse to accept help. They could possibly deny that they have a problem or simply not want the medication. But according to Anxiety BC, families and friends can be helpful to people dealing with anxiety by learning about what triggers it, and should gently nudge towards the situation that the person fears. It's not helpful to force those people into situations that trigger their anxiety. In this case, facing your fear only makes the problem much, much worse. Anxiety is a major issue in today's world, and people that have an anxiety disorder deserve the help that they need. And to help those with an anxiety disorder, you can learn to understand anxiety and help those by encouraging them to go to their doctor or even certain types of therapy. Now that you have learned a lot about anxiety disorders, maybe even thought about it and realized that someone you know has an anxiety disorder, you should help those people by gently nudging them towards anxious situations and suggesting they go to their doctor.